Joe 200, how are you? All right, so this is our second module on diseases. We're going to be talking about diabetes today. Today is February 13, 2019. And I just wanted to delay this video because I was hoping all of you would go in and check the video where President Obama talks about health insurance and disease and how important health insurance is. And just remember that because of that law, of the Affordable Care Act, people like Julia that have cancer would no longer bankrupt their family, and they could no longer be denied health insurance. So that was a huge law, huge law. All right, so now we're switching to diabetes, okay? So what we're going to do is we're going to go ahead and go into the weekly assignments right here, okay? And we'll course down to see where we're at here, and it's amazing what kind of progress we're making. Week 1, week 2, week 3, week 4, week 5. Here we are in the 6th week, okay? And as I indicated, the topic this week is diabetes. Now this is a big one, okay? This is the #1 cause of disease in our country, #1 cause of disease in more privileged countries, really, countries of excess, okay? And it shows you the importance of diet and exercise in this disease. It is in large part preventable. However, if you have a history of diabetes in your family, you're likely to have a genetic vulnerability. So that just means you have to work harder at it, okay? Diabetes is a huge risk for cancer. Diabetes is the #1 risk for vascular disease, okay? And that's important, as I'll show you later, because that'll be our next topic. We'll be talking about diabetic heart disease. And in keeping with what's going to be coming up in terms of our critical thinking assignment, the next one right over here, CT2, you're asked to link diabetes and heart disease and then Alzheimer's disease. And staggering statistics, like 80% of all people with Alzheimer's disease also have diabetes. Okay, so I know it's midterm season right now. I just had 2 midterms. I had a midterm in JL 414 and 315. A lot of you probably were in the 315 class. I'm sure you all did well. So what we do, again, these are all the PDF files of everything you need to look at here. Sometimes we find that the links will change, and that's why we stack all the PDF files. So you can look at these and read these individually. And again, this is where you'll be able to answer the quiz, which is coming up right down there, okay? Also, watch these videos, okay? And you'll understand what's going on in terms of diabetes, okay? All right, so we can begin right here. So the link is still working, okay? So if you click right here, okay, it takes you to the National Institute of Diabetes and Digestive and Kidney Diseases. Really, really informative. And what you basically are asked to do is you just scroll through this website and you're going to find out what is diabetes. Type 1 diabetes, okay? This is an autoimmune disease, okay? It is also called juvenile diabetes because it affects young people. It's a lifelong battle for these people. These are completely dependent, these patients are completely dependent on insulin injections. And then there's type 2 diabetes, and this is what's called age-related diabetes. This happens later in life. It's initially associated with your insulin receptors no longer working correctly. We call that insulin resistance. The receptors are resistant to the actions of diabetes. These patients are asked to exercise and diet, okay, to modify their risk, to improve the sensitivity of their insulin receptors. However, once they've been diagnosed as a diabetic, it is a lifelong disease that they're going to have a challenge with. And there are a lot of alternative therapies besides injecting themselves with insulin. Therapies like drugs that will change the way you absorb glucose, or therapies like drugs that will change the way your kidneys handle the glucose. So to get rid of blood glucose, you can basically pee out more glucose in your urine. Okay. Alrighty, it goes through the different types of diabetes. I encourage you to look at it. The video starts talking about some of these other problems, okay, that are called diabetic complications. And again, you can just look at this and you can see what a giant health burden diabetes is. Okay, it's a sociological burden. It is a gigantic financial burden to the individual and to our society. So this is basically the same kind of choices that we had back here. Okay, so you can look at what insulin resistance is. You can look at these different types of things. I want to go back here. Okay, all right, and we're not going to use that. Okay, and we can look at some of the topics that are raised again in the quiz. Okay, stuff that I want you guys to understand. You should be exposed to this because there's a big chance that you'll know somebody with diabetes or that you'll have a family member that has diabetes. These are the tests that are on to see if you're a diabetic, and it goes through each of these. Again, these are hypertext links to different parts of this reading. Okay, and you just scroll through this, and this diabetic the hemoglobin A1C test, or the A1C test as it's called, is the most accurate of the tests, and it's just a measure of the continual levels of blood glucose in your blood. And what happens is these proteins get candy coated with glucose. Okay, that's the hemoglobin protein that is known that you have inside your blood cells. Okay, so again, look into this right here. Okay, we will also, so you have levels that are expected, and charts that show changes in A1C. So again, just kind of review what A1C test and diabetes is all about. Okay, alrighty. Then you go back. Okay, and you look at other complications. So a big one, of course, is heart disease and stroke. Okay, and little tiny strokes can cause dementia. So that's a link to, again, the critical thinking assignment. Okay, so so there's a huge risk. There's a giant link between diabetes, heart disease, and stroke. Okay, and again, it's a major sociological, major political, and major personal financial issue. So I'm not going to read through this. I just want you guys to kind of scroll through this and read through it on your own. Okay, so that's what this website is all about. Okay, and these articles right here are basically we made PDF files of all the relevant hypertext links in here. Okay, this is another nice PDF file. Okay, and it's coming up right now. Sorry, into my other browser, and waiting for it to come up. And what I'm going to do is I'm going to go back here and so what this is looking at the relationship to diabetic heart disease and stroke. Okay, and again, it's a super important thing. Okay, so here we are right here. So we just copy this, and so you can look at this link and study this link. Okay, super important. Okay, all right, that was kind of not necessary, but that's all right. So we have it now. Alrighty, that's Yahoo email, and we're going to go back over here. Okay, alrighty. So do watch these videos. So this gets into the actual mechanism. 3-minute video, like
understanding type 2 diabetes.
Animated patient that has diabetes. So explains everything that you need to know.
Sugar in the form of glucose to accumulate in the blood rather than being used as fuel by the cells in our body.
All right. So I'm not going to watch this video. You're going to watch it. And then this one right here looks at diabetic complications.
Hello, everyone. My name's John, and I was diagnosed with type 2 diabetes some years ago.
So you'll find out all the problems that is associated with that. Okay, awesome. So please do this and think about, as you're doing this, think about, I'm coming back over here to the upcoming critical thinking assignment. It's right around the corner. Okay, it's next month. It's due March 4th. Again, just a couple of pages long. Okay, we scroll down here past CT1, and you guys did a great job on that. And we look at CT2 here. Okay, this is kind of our objectives that you're going to look at pathology and normal aging, okay? And then we come down here and we ask you to, basically you're going to be clinicians and you're going to look at this patient. Look at a presentation of somebody who's starting to have problems, okay? Edwards becomes forgetful. He's wandering, okay? Signs of Alzheimer's disease, okay? Edward has type 2 diabetes and has had so for a long time. So the kind of tests you're going to run treatments for your patient, okay? Test for diabetes, test for Alzheimer's. What is out there? The best thing that's out there is called a mini-mental status exam, okay? Talk about this link between diabetes, heart disease, and Alzheimer's disease. Super important that you do this in your discussion, okay? We should explain to the patient and his family how treatments for Alzheimer's disease and diabetes work, okay? All right. You can include these types of graphs, okay, and descriptions of this link between diabetes and Alzheimer's disease. Like I said, type 2 diabetes is age-related, okay? It's the most common form of diabetes, and people in the Alzheimer's field refer to Alzheimer's disease as type 3 diabetes, okay? Because, like I said, 80% of people with 80% of people that have Alzheimer's disease have diabetes. Okay, so we'll come back down here again, here to this section. And now we're going to look at the discussion, okay? Hopefully, none of you are going to have this problem, okay? The biggest risk factor for diabetes is obesity, okay? Especially tummy fat, okay? And it's associated with this insulin resistance and all kinds of complications. So let's check you out and see what your lifespan is going to be. Check out your body mass index. It's not hard and fast. Some guys that are athletes, women that are athletes, you're going to have a higher BMI. Still, just go in there and you calculate it and you play with it. Okay. And then you come down here again with these are other life expectancy calculators. Okay. And then we want you to look at me and compare me to the national average, and then also check it out with respect to yourself. Okay. All right. So we look forward to this. This is going to be a short video. Okay. But that's basically the approach. It's self-paced. Okay. And I think you guys are going to kill it. With reference to today's Wednesday night, if we go back here to the weekly assignments, okay, and just to kind of, again, personalize things. So this was cancer, and I showed you kind of some of the things we had for Julia right here, okay, and then we come down here and we had this whole discussion of death and dying, and part of the process, we're again living this. We're flying back to New Orleans tomorrow morning, first thing in the morning, because Julia's mom died of a heart attack, okay, roughly 2 months ago. And so we're going back to New Orleans for her memorial, and this is part of the culture of death and dying and how we have to deal with it. Part of the things that Julia's done is to create the memorial PowerPoint with music behind it. There's actually companies that can help you with that. She also made the announcement, okay, about it. And so all of this part is something that is very real, and it's something that we all have to go through. Alrighty. Okay, so that is it. And we'll see you next week. We're going to launch from diabetes to heart disease. All right. So we'll see you next time.